Well, today we're connected with pulmonologist Dr. Dwi Yuliati from the Indonesian Pulmonologists Association in Malang, who is currently working with other volunteers in the Semeru area. Good morning, doctor. Thank you for joining us on the C Morning Show today.
Good morning.
First of all, we would like to ask, what is the condition of the victims so far right now that have been suffering any sort of respiratory problems or any other injuries from Mount Semeru?
Okay, thank you. The condition in Prono Jawa Lumajang that happened volcanic eruption has caused a negative influence in health condition. Burning coming of contact with hot lava is a special serious problem in health. Yes. There is many major burning. There are 22 major burning that we refer to 3 hospitals: Pasirian Hospital, Bayangkara Hospital, and Haryoto Hospital. But about minor burning, we treated in Benanggal and Candipuro Public Health Center. Besides that, the volcanic ash can also cause respiratory problem. That's so many serious problem in respiratory.
And just elaborating on that exactly, because we know that the gases that are being emitted by the volcanic ash, as you mentioned before. Can you elaborate further on the respiratory issues? Because there have been reports of people there experiencing some respiratory issues. What kind of problems could occur because of inhaling or exposure to volcanic ash, and how severe can they get?
Yes, volcano ash can cause a respiratory problem. There's a thermal injury can currently affect in respiratory system. There are two cause two conditions in respiratory problem. There's acute condition and chronic condition. That depend of dimension mineral, exposure, and type of ash volcanic. In acute condition, it's caused by irritation of the respiratory tract. There is cause acute respiratory infection like tonsillitis, sinusitis, pharyngitis, laryngitis, and asthma or COPD exacerbation. And chronic infection that can cause very, very serious problems, especially as silicosis and can trigger of lung cancer.
Doc, what are some of the symptoms of these respiratory problems caused by volcanic ash? What should people look out for if they're in the general area? And what are some of the things that maybe can be done to help alleviate these symptoms or make it so it's not so difficult?
The symptoms of problem in respiratory infection is acute respiratory infection. There's coughing, there's more symptom, shortness of breath, fever, myalgia, discharge of nasal, nose and skin irritation.
It's a lot like smoke inhalation, yeah? Except it's probably more toxic.
Yes.
Okay.
So just out of curiosity, currently the team that is volunteering on standby helping people that are affected by this particular disaster, you can say, what are the treatments that are done for the victims who have already reported these particular symptoms? Are they being checked on severity? Because I heard also that you mentioned asthma before. If you already have an underlying, asthma condition, that could be also perhaps very, very dangerous for them.
Yes. In general, the treatment we give is two supportive life treatment. We give step by step. The patient we evacuate to the harm place away from exposure. The second is we basic life-threatening. The third is we maintain the circulatory respiration, including about ventilation and oxygenation. And the fourth, we maintenance of circulation to prevent of hypotension and shock. This patient we place in a supine position. The bottom is rises. We give a blanket or jacket, and we give fluid circulation, especially as fluid intravenous. And
Yeah, go ahead. Go ahead. Please continue.
yes, and a special condition, we give a treatment about according a symptom of the patient. We give oxygenation, we give a bronchodilator, antihistamine, we give a mechanic ventilator if the patient have suffer of respiratory failure, the patient.
Okay, so these are all a lot of the supplies that are needed, supplies and medication needed to immediately treat some of the patients according to what they need. What is the supply like currently in the surrounding area of Mount Semeru? Are there sufficient supplies to treat all the patients that are coming in with any of these symptoms? Is there enough, or does more have to be brought in anticipation of more patients?
The patient need very much less for the patient,
Okay.
and that's the primary protected for the inhalation.
Okay.
All people must use a mask as to prefer inhalation. We have 10 ventilator as coming yesterday from Surabaya. That is
Oh, good.
to prevent respiratory failure
That's
in
good.
our hospital, in Haryoto Hospital.
Okay.
So you also mentioned masks because right now we are mandated to wear masks anyway because of the COVID-19 condition. Has there been, though, in terms of safety protocols in place as well, has there been any COVID-19 infections found? Because this could be, an overlap when you're currently going through the pandemic as well, and then this happens. And we also know, you just mentioned one of the important things to tip by doctor was to wear a mask. Is there a special way to wear a mask when you are currently, being exposed to volcanic ash as a certain, perhaps, tip to prevent further respiratory issues?
Yes, Alhamdulillah, COVID-19 in our country, Indonesia, is minimal, but we must to prevent. There is a mirror mutation that's similar of a treatment with effect of volcanic ash and COVID-19. Yes, there is a protocol here we must do, especially as the first is use mask for all people, and the second is hand hygiene. Hand our wash with water or anti desensitization. Yes, there's two kind that we do in this condition. In this condition, in eruption Semeru, we cannot social distancing. That's hard to do to social distancing.
Sure.
So two things that we must do that use mask and hand hygiene, hand wash the people when after they touch from anything in around, and after touch of the other people, they must hand wash with a sanitizer or with water and soap.
Doc, well, lately we've gotten reports that there have been rainfall in the area, and earlier we heard from one of the victims there that they said they were glad it rained because they were able to breathe a little bit again. How does rain affect this entire situation when it comes to volcanic ash? Is it actually better that it rains so that it takes the ash out of the air so people in the area can breathe, or is that actually making it worse because it's mixing it into a more of a water-based toxic ash?
Uh, to mind health respiratory, we can do in disaster time. We can use a measure and we to reduce to outside at home, yes, to prevent falling ash. And after disaster, the people can come back to their home if the place, safe place, if the authorities ask to them that place is safe. Is that beside that, of course, to consume had food and to think to maintain the thing, okay, for positive thinking. They cannot depressing, they cannot get peace heart to accept their condition.
It's very important to have a good state of mind when facing
Yeah.
these kind of situations, definitely.
Right. So, Doctor, we want to thank you so much for the latest update, and we want to wish you very, very good luck, especially in your team and volunteers there in Lumajang right now. Hopefully, all the victims, will be returning to the safe places really, really soon, and you as well. Please stay healthy and safe. Thank you so much for your time with us.
Take care, Doc.
Take care.
Stay safe out there.
Thank you.